Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Kwara State government moves to create awareness of Delta variant, lays emphasis on observance of non-pharmaceutical interventions. Safety conditions in workspaces in focus amidst observance of COVID-19 prevention protocols. And from August 6th in Italy, people will be required to show a green certificate to access indoor recreation venues. The World Health Organization says African countries will need 21 million COVID vaccine doses weekly to meet the 10% population target by September. Dr. Mashidiso Moeti, WHO Regional Director for Africa, said at a briefing that nearly 70% of African countries will not reach the 10% vaccination target for all countries by the end of September at the current pace. According to her, around 3.5 million to 4 million doses are administered weekly on the continent, but to meet the September target, this must rise to 21 million doses at the very least each week. Meanwhile, the Nigeria Center for Disease Control, NCDC, confirmed 184 COVID-19 cases across 7 states and the FCT, the latest figure a 22.69% decline after recording 238 cases Wednesday night.
Some of our brothers and sisters will...
While Nigerians wait for the delivery of a second batch of vaccines, the Nigeria Center for Disease Control says Nigerians can take responsibility by wearing a face mask in public spaces, staying 2 meters apart from each other and avoiding contact with people outside their homes, as well as washing hands frequently with soap and running water. Other safety measures are avoiding unnecessary travel and staying away from large gatherings. The NCDC is reporting 184 new infections of COVID-19 from 7 states and the FCT in the last 24 hours. This is a drop from the 238 cases recorded in a previous 24-hour cycle. Lagos reported 124 cases, which accounts for more than 67% of the cases in this cycle. Rivers had 27 cases, Sokoto reported 9, the FCT 8, Oyo 6, and Ekiti had 5 cases. Delta had 4 cases, and Plateau State recorded 1 case. Nigeria now has a total of 170,306 confirmed cases. 31 people have been discharged in the last 24 hours, raising the total number of recoveries to 164,772. Over 2.4 million samples have been tested so far. There has been no death from COVID-19 related causes in the last 24 hours, so the fatality toll remains at 2,130. In Africa, the cumulative case count is edging closer to 6.4 million, and more than 161,000 deaths have occurred on the continent. Globally, more than 192 million COVID-19 cases have been confirmed, while deaths have surpassed 4 million.
The discovery of the Delta variant of COVID-19 has been generating reactions across the world. While some believe the relevant agencies and government at all levels should intensify efforts in the Enlightenment campaign, others say it could lead to another lockdown in various states across the country.
In Kwara State, some of those sampled say the onus is on the government to create awareness for the populace to know just how deadly this new variant is.
We want our government to actually come out and tell us that this another new variant is out, and of course we read as well that it is more transmissible, more deadly than the one we are having at hand. So in a situation like this, we will expect, a kind of proactive measure so that we will know how to go about.
On the likelihood of another lockdown, many are of the opinion that the country cannot afford another at this time, going by the effects of the last one.
The best way to go about it is self-protection, and the government should ensure more campaign on how to embark on self-protection, because the masses cannot afford to go on lockdown again, because the effect of the last lockdown is still much around.
We should try as much as possible to observe the protocols of COVID-19 and try to prevent the spread of either the first or the second wave of COVID.
The Commissioner for Health, Dr. Raji Rasaki, has set several awareness programs in motion to ward off the Delta variant, though it's not been detected in the state. If residents are complacent, he says, it could lead to another lockdown in the country.
We have intensified the awareness campaign for our people, especially we ask them to continue to maintain the preventive measures like the use of face mask regularly, nose mask regularly, hand washing with soap and water, avoid crowded environments and observe social distancing, and the use of hand sanitizer is very germane. So all these have been ongoing, and our emergency preparedness and response team, they are alert to ensure that we prevent the third wave of COVID-19 in Kwara State.
He also dismisses false rumors circulating about the vaccine, stating that it's been proved that vaccinated individuals are less likely to contract the Delta variant of the virus.
In Lagos, although some civil servants still have to work from home, nothing is being left to chance among those who resume in person. Workers are seen wearing masks in a bid to contain the COVID-19 outbreak and, of course, to stay safe.
Motorists are out to get their daily bread. Residents hop into vehicles to get to their various destinations. At the State Secretariat at Lausa, civil servants trickle in with their face masks on and ready to resume their work schedule. Mindful of the COVID-19 pandemic, they advise their colleagues to observe the safety protocols.
We cannot, because of COVID, say we cannot resume. We will resume, but the necessary precautions that should be put in place should always be there, so that people don't get affected randomly. I believe that if Nigerians should comply with the NCDC directives on this, somehow we will be safe.
The Lagos State workers, we are very much eager and anxious to back to work. And I will urge all our workers to be cautious of COVID-19. The imminent third wave COVID-19, we should be very cautious because life has no duplicates. We should always make use of our nose mask, make use of our sanitizer, and be cautious generally.
As the workers settle in at their various ministries and departments, the expectation is that they will channel their energy towards delivering on their jobs for the benefit of the state as a whole.
And to preventing a third wave, joining us right now from our Abuja studio is Dr. Yahya Disu, who is the head of Risk Communication Division with the NCDC. Thank you for joining us on the program.
Thank you for having me. Good evening, Nigerians.
All right. Now, just before we delve into COVID-19 proper, just want to hear from the NCDC, and this is following the update on monkeypox based on the index case who reportedly traveled from Nigeria to Atlanta. What is the NCDC hearing about this?
The necessary things we have to do is to follow up and with the state where this case was reported, and that is being done. Even before now, monkeypox has been part of our routine surveillance, and there is what we call enhanced surveillance, which we have also started. And in the states with high risk, we have been reporting more of these cases, like in Rivers State, in Akwa Ibom, and then also in the South region, Bayelsa State. So efforts have been ongoing to ensure that this is detected. I also, across the states in the country, there is also surveillance for monkeypox. And personnel have also been trained to ensure that they're able to detect these cases. But what we also need to do is to report, to encourage community members to understand the signs and symptoms so that they can report as soon as they see this. So I think that is the update that we can provide now.
All right. On COVID-19, Lagos has been witnessing an increase in daily cases, over 100. How much of the rise is as a result of the Delta variant?
Well, it's too early to say this is the proportion of the Delta variants in the Lagos State COVID-19 reported cases. But if you remember, a couple of days back, the Commissioner for Health for Lagos State was also talking about different variants they have in the states, and they are strengthening the interventions, non-pharmaceutical interventions, the surveillance, even at the point of entry to ensure that they're able to detect new variants that come into the country and to also prevent transmission of existing variants in the country. So it's still pretty early to know what proportion of the cases that this variant is. But the variants they are picking, they are doing genomic sequencing for all the cases to be able to actually describe or understand what variants they have in circulation.
And staying with Lagos, Dr. Disu, a week ago there was fear, anxiety over how the University of Lagos shut down hostels due to the coronavirus threat. On that situation, especially with how they went about it, what is the latest in terms of the cases emanating from the school? And based on the guidance that the NCDC has put out there for schools on the COVID-19 public health measures, those procedures, were they in the best interest of the students and the lecturers?
Anyway, the situation in University of Lagos last week is a learning curve, even though there are better ways to handle such situations. Because closing down the school suddenly is not in the best interest of the school itself and the community. We understand the affairs. It also shows that we need to strengthen preparedness in our higher institutions. What it means is, first, I want to commend them for them being able to detect this early, and then to be able to also make sure that they warn the students, because according to a report that we got, they tried to warn the students. Since the students were adamant, they were not compliant, that's why they had to take that decision. But that would have been better if the decision was taken in conjunction with the State Ministry of Health that have the state COVID-19 response system, and so that they can be part of the wider response. With regards to the guideline specifies that each school or institutions should have a committee, the school health committee or COVID-19 response committee, that will be working with the state team. And in terms of surveillance, if they see cases, they report. And then the state will be able to come to support them. That way, when the state is responding, it's not just the state, it also includes the national support. So those are areas where we need to work. We know that we don't want this to be repeated in other higher institutions of learning. We're trying to work with the stakeholders of higher institutions to ensure that all the relevant stakeholders come together. They understand this guideline, how they need to implement them, how they particularly need to work with the state Ministry of Health, who are leading in this COVID-19 response in the various states where these higher institutions are situated. So it's a learning curve for us. We continue to see how we want to improve on this situation.
All right, we would like to appreciate your time on the program. Dr. Yahya Disu, Head of Risk Communication Division with the NCDC. Thank you so much for joining us.
Thank you for having me.
We have more on the COVID-19 update when we return. Please stay with us. Welcome back. Before COVID-19, there was an epidemic for which the world is yet to find a cure, the human immunodeficiency virus, which causes AIDS. Some activists in South Africa recently appealed to world leaders to endeavor to sustain attention given to HIV/AIDS management and research so that past gains will not be rolled back. Our SA Bureau Chief, Betty Dibia, spoke to a senior lecturer and clinical epidemiologist at the University of Sussex about the concerns.
It's certainly a concern that the response to the COVID-19 pandemic has negatively impacted HIV programs globally, more so in sub-Saharan Africa, And this is because implementation of quarantine measures, social distancing, and community containment measures required to control the pandemic, especially in the first wave, which was very strict in some settings, yes. Resulted in a reduction in access to routine HIV testing. There was a reduction in access to people already established on treatment, having a refill of their medications when they were. And there was also delay in starting people newly diagnosed with HIV on treatment. There was also an impact on HIV prevention, for example, access to condoms, HIV pre-exposure prophylaxis. So the pandemic and the response to it has actually been very disruptive to HIV programs globally.
Are you still worried now? Now, what you just said, is it South Africa specific or globally?
It's affected different settings to different extent. Some studies actually did show a reduction in access to treatment. There were surveys conducted by different organizations that showed there was difficulty in people accessing their treatment. If the government has to prioritize one thing, it should be making sure there's uninterrupted drug supply for people already living with HIV. That they'll be saving the most amount of lives doing that.
Now to Germany, where it continues to grapple with the fallout of a historic flooding disaster that left more than 160 people dead and towns and infrastructure ravaged. Fears are growing that the affected areas may become coronavirus hotspots, bringing two major crises together. Deutsche Welle correspondent Janelle Dumalon joins us now from Berlin. Hi, Janelle. What has prompted those fears of increasing coronavirus cases in the disaster-stricken regions?
Well, just to give you a picture of how it is at the moment, the round-the-clock recovery operation is still underway. Hundreds of people are still missing. The big cleanup effort is also still ongoing. You have entire villages that are basically still covered in mud. Tens of thousands of people still have no access to drinking water or electricity. Survivors are being housed in emergency shelters where you can well imagine it's very hard to maintain social distancing measures. And it has to be said that they've lost everything. Coronavirus protection measures aren't top of mind for them at the moment. You also have people coming from all over Germany in order to participate in the rebuilding and in the cleanup. So you have lots of people at the same time, at the same place, working shoulder to shoulder on this, and that's not really the best from the transmission prevention perspective, but of course they have to be there. And the disaster itself also interrupted the ongoing vaccination rollout. It also destroyed key testing infrastructure. And all of these things taken together have fueled fears that we are indeed going to see an outbreak in this region.
So what are the things that are in place? How is the situation being dealt with?
Well, they're still trying to get people vaccinated. So they've been, for example, sending in mobile vaccination vans. And just in general, officials at the state of North Rhine-Westphalia, which is one of the states most affected by this disaster, they have been stepping up calls for everyone who is able to get vaccinated to get vaccinated. The logic, of course, being that every vaccinated person presents less of a risk of putting strain on the health system. And it also has to be noted that really hundreds of people provided financial or physical support to the flood systems. The show of solidarity, really something to behold here in Germany. And for its part, the German government this week released a 400 million euro aid package meant to provide immediate relief to those affected by the disaster, to allow communities to get back on their feet, to allow life to continue.
So essentially, in terms of finances, will German finances be able to weather a major construction effort and pandemic measures at the same time?
Well, the quick answer is that Germany has to be able to handle this. Now, one of the reasons that Germany was able to deploy financial resources so rapidly when the pandemic hit was that for years it had squirreled away money, even to the point where it was criticized for underspending. But the flip side is that this disaster has shown that underinvesting in infrastructure is not tenable. So this is an opportunity to build back better, stronger, more resilient infrastructure. Not doing so will cost the German economy more in the long run, and as such, that's really not an option that Germany should take.
Jamil Dumala, DW correspondent, thanks for that update. And the UK's Office for National Statistics has released data from its weekly UK COVID infection survey showing that in England, almost 750,000 people in private households are likely to have had coronavirus in the week to July 17. Meanwhile, in Italy, you'll need a COVID pass indoors. Here's the global update.
The Italian government says people will need to show a digital green certificate to gain access to a range of indoor venues, including restaurants and cinemas, from August the 6th. Anyone over 12 will be expected to demonstrate they have had at least one jab, tested negative, or have recently recovered from the virus. Prime Minister Mario Draghi says the expansion of the use of the EU certificate scheme is essential to keeping businesses open. Meanwhile, the French government's advisor on COVID-19 says a return to normal life following the COVID-19 virus outbreak may not occur until 2022 or even 2023. During a TV interview, he said France could reach around 50,000 new daily COVID-19 cases by the beginning of August and warned against going to nightclubs despite their reopening, and that the fourth wave of a new coronavirus infection should hit French hospitals in the second half of August. Iran's supreme leader has received his second dose of a homegrown COVID-19 vaccine amid a fifth wave of the pandemic in the country. He received his first dose in June. Iran is the epicenter of the pandemic in the Middle East, with a total death toll of over 88,000 people and more than 3.6 million cases. Finally, U.S. President Joe Biden asked whether vaccinated Americans would be asked to wear masks again as COVID-19 cases rise, says his administration would follow the science. He emphasizes that newer infections are affecting people who have not been vaccinated.
If you are vaccinated, you are safe. If you are vaccinated, you have over a 98% chance of never catching the virus at all. If you catch it, you're likely to, the overwhelming proof so far is you're not going to be hospitalized, you're not going to be sick, you're going to probably have no signs that you had it, and you are not going to die.
The president's remark comes as COVID-19 cases are climbing in some states in America. Vaccination efforts stall on skepticism and disinformation.
Stay safe, continue to take responsibility. You can visit our websites for more updates, also a better understanding of where we are in the pandemic. You have that top story there on COVID-19 wave, Kaduna government urging residents to take responsibilities. Also the message across states from the government. It's channelstv.com and it's at your fingertips. And that's COVID-19 update for the week. Thank you for watching. I'm Millicent Walker. Stay safe.